This is Chris Watts at Motion Dynamics Limited. I'm an integrative manual therapist and mobility flexibility specialist. Our job is to identify resistance and restriction in the soft tissue and joint structures for movement improvement. This short video is to give you my top 5 stability training exercises to help relieve your lower back irritations, discomforts. Each exercise is performed between 10 and 12 times. There are 3 sets for each one of these exercises. And you really want to come up nice and slowly, 3 seconds up, hold it for 3, and 3 seconds back down again under controlled movements. Before you do any of these exercises, make sure that you've seen your primary healthcare practitioner and they will have assessed your movement, your functional movement, and also your posture, and they're making sure that you're doing the right kind of exercises for your issues. This is called the pelvic bridge or hip thrust. So I'm going to be lying on the floor on a mat. My heels are into the mat, and I'm going to tilt my pelvis backwards just to engage the lower abdominals, and I'm going to push the heels into the floor in this particular case and hold this position for 10 seconds. You can have your hands up here or down here, it doesn't really matter. And then you can feel the glutes, the lower back, and the upper hamstrings all engaged. And you do this, as I said, nice and slowly, back down for 3 seconds. This is a reverse hyperextension to specifically target the deep lower back muscles. So what we do is we lie across a chair like this and just pivot yourself right over the chair with your chest on the chair, and you want to lift both legs up so they're just below parallel to the floor. Hold this position for at least 10 to 12 seconds and then slowly lower again. And this focuses the glutes, the hamstrings, and the lower back. So the next exercise is for the gluteus maximus, our most powerful muscle, very important stability muscle in the back, posterior chain. So we're going to be lying down, face down. We're going to be bending the knee, and we're going to be slowly lifting the heel towards the ceiling. Don't go too far, maybe sort of 20 degrees maximum. Hold it for 3 seconds, and then slowly lower down. And you want to be doing 3 sets of 10 of these or 12 of these exercises, and back down again. The simplest lower abdominal exercises you can do are reverse sit-ups. So we can take a bench like this or a chair like this, and then you can cross over the ankles, draw the knees into the chest, and then straighten out again. So you're a little bit back on your sits bones, and all this is focused on your lower abdominal muscles, the TVAs as they call them, and very good for supporting the pelvis and supporting lumbar stability. So this exercise is for the latissimus dorsi and the lower trapezius, helps to support again the upright posture. And what we do is we lie down on a mat, the heels are together to engage the glutes, and we have our arms in front, slightly extended in the spine, and we draw the arms down like this, called a low row. And we're going to be doing this 10 to 12 times, and slowly release it each time, and we're going to do 3 sets of those.